Welcome back to the Morning Blend. Many seniors feel burdened by health care expenses, yet a new survey reveals they are more likely to comparison shop for groceries, gas, and even cable than they are to shop around for a Medicare plan. With the enrollment deadline just around the corner, Bart Astor, an expert in eldercare, is here to discuss the risks faced by seniors who don't review their Medicare plans. Good morning to you, Bart.
Hi, nice to be with you. Thank you very much, Molly.
Absolutely. While it might be disappointing to hear that people are more likely to shop around for things like groceries and gas and even cable than Medicare plans, I guess I'm not surprised. I think it's very complicated to take a close look at Medicare plans and things that are complex like that.
I agree. In fact, this cost of complacency survey that WellCare sponsored came up with some very interesting results. As you pointed out, despite the fact that healthcare is the most burdensome of our living expenses, even compared to groceries and food and transportation, they don't comparison shop for their healthcare coverage as much as they do some of the other things like, as you said, internet plans and cable and even gas. So it is kind of surprising because of the importance of it. At the same time, we know that over 60% of people who responded to the survey do not review their plans annually. I think that's a little bit of a danger. They're putting themselves at risk, and they also might be leaving money on the table.
Yeah, and that's unfortunate. So let's look at this year, for example, as we look to 2018, and we know that the deadline for open enrollment is going to expire soon. It's early in December. Is there still time for people to review their plans?
Absolutely. In fact, December 7th is the hard and fast deadline. So you still have a little bit of time, and take that time to review what your coverage is now and what your coverage is going to be in the coming year. And that might change. As you know, our health changes, our seniors' our life changes, and we may have different needs in the future. But you have time to just take the time, review the plan, and we know it's difficult. We know that most seniors who look at this look at reviewing their health care plan as just one of the most unpleasant things to do. They even look at it as worse than going to the DMV to renew their licenses, or even worse than doing their taxes. Yeah, we know that it's complicated, it's scary, it's confusing. There's so many different options you have, but if you take the time to really review what your needs are, I think you'll be well rewarded by doing so.
One of the things that people often look at is the cost of their premium, and people want a low premium because that's something we pay out each month. Is it enough, though, to just shop for the plan with the lowest premium?
No, as you suggested, it's certainly not enough to just look at the premium, because you know that there are other costs. You're going to have co-pays. You're going to have deductibles that you're going to have to pay for out of pocket as well. There also may be some other costs that you're not aware of. Certain diagnostic tests may not be fully covered in traditional Medicare. So if, for example, you have a lot of PET scans or MRIs, you might run into lifetime limits, which means that there's going to be a higher out-of-pocket cost for you. So be careful to not only rely solely on the premium.
It's great advice. There is a cost to being complacent, so don't do it. We're going to share again your website. Thank you so much for joining us. It is costofcomplacency.com. Thank you again.
Thank you.